Hi everyone, welcome back to another YouTube video, and today I'll be talking on anthrax in animals. So let's get right into it. Anthrax in animals. In July 2024, a dairy farm in rural Haryana faced a nightmare. Within 48 hours, three adult cattle suddenly died with unusual bleeding from body openings. The diagnosis: anthrax, one of the most feared bacterial diseases affecting livestock and humans. But here's the good news: rapid response saved dozens of other animals and prevented human casualties. By the end of this video, you'll know exactly how to recognize, prevent, and respond to anthrax. What is anthrax? Anthrax is caused by the bacterium Bacillus anthracis, which forms extremely resistant spores that can survive in soil for more than 50 years. Key facts: it primarily affects cattle, sheep, goat, and buffalo, can infect humans through animal contact, they are highly fatal in animals without immediate treatment, and the spores can survive for decades in contaminated soil. Three forms in humans include cutaneous, gastrointestinal, and intestinal. In animals, it appears as per acute, acute, and chronic. Critical symptoms to recognize: in cattle, sheep, goats, and buffaloes, the peracute form, seen in 60 to 70% of cases, includes sudden death, bleeding from openings, rapid bloating after death, blood doesn't clot, and no rigor mortis. The critical observation is that animals are found dead with bloodstained discharge from body openings. The acute form, seen in 20 to 30% of cases, show high fever, severe weakness, swelling, bloody diarrhea, and death within 24 to 48 hours. In humans, cutaneous anthrax is most common. Small inchy bump develops into a blister and then a black scar, which is the characteristic sign. Bloody diarrhea, severe pain, and inhalation includes flu-like symptoms, severe breathing problems, and then death. How it spreads and risk factors. The deadly cycle. Infected animal dies and blood contains bacteria. The blood is then exposed to air, forms resistant spores. Spores contaminate soils and survive for more than 50 years. Animals then graze or drink from contaminated areas and ingest spores. The animal dies and the cycle repeats. Highest risk areas in India. In the south, it includes Andhra Pradesh, Tamil Nadu, Karnataka. In the east, it involves West Bengal and Odisha. In the west, it's Rajasthan and Gujarat, and parts of Madhya Pradesh and Maharashtra. The risk increases with drought followed by heavy rains, soil disturbances, unvaccinated herds, and areas with previous outbreaks. Treatment reality. The critical truth is that for animals, per acute cases show no possible treatment. Death is too sudden. In early acute cases, antibiotics may work if caught within hours, but the success rate is very low. Emergency protocol. If caught early, immediate isolation and restrict farm movement. Notify authorities immediately, and antibiotic therapy should be started along with emergency vaccination. Reality is that most animals die before treatment begins. Prevention is the only reliable strategy. For humans, cutaneous cases, ciprofloxacin or doxycycline is given. In gastrointestinal or inhalation forms, hospital ICU care along with combination antibiotics are given as treatment. It is important to know that anthrax is a notifiable disease. Any suspected case must be reported immediately. Prevention saves lives. Vaccination is your best defense. The Stern vaccine should be administered annually, vaccinate before the monsoon season, and immunity develops in within 10 to 14 days. During outbreaks, emergency ring vaccination should be administered. Carcass management. Never perform post-mortem on suspected anthrax cases. Opening the carcass releases billions of spores, contaminating the environment for decades. Proper disposal. Deep burial should be conducted. Line pit with lime. Place carcass without opening it. Cover with thick lime layer. Fill and compact soil. Mark the site permanently, and the location should be 100 meters or more away from any water source. For protection, make sure to wear full PPE equipment, including gloves, boots, and protective clothing. Food safety rules. Never consume meat from sick animals, buy uninspected meat, eat undercooked meat in endemic areas, and always buy from licensed butchers with an inspection stamp. Cook thoroughly and report sick animals immediately. Biosecurity basics. For farmers, vaccinate all animals annually in endemic areas, report sudden deaths immediately, quarantine new animals within 14 to 21 days, avoid deep grazing during dry periods, provide clean water sources, and for animal handlers, wear protective clothing, wash hands thoroughly after animal contact, report cuts or wounds that contact animals. Success stories. Remember the July 2024 outbreak? Day 1, 3 cattle died. Owners called authorities, the farm was quarantined, and no post mortem was performed. Day 2, anthrax was confirmed, emergency vaccinations were administered, and deep burial with lime was conducted, and a public alert was issued. From day 3 to day 7, worker prophylaxis was conducted, environmental disinfection, and health monitoring. Outcome: there were zero additional animal deaths, zero human cases, and the outbreak was controlled within 28 days. But what made the difference? Immediate reporting, no carcass opening, rapid vaccination, proper disposal, and community cooperation is what did it. This proves that anthrax can be controlled with knowledge and fast action. Do this now. If you're a livestock owner, make sure to check the vaccination status, schedule vaccination if in an endemic area, know the symptoms, save emergency numbers, plan disposal protocols, and if you work with animals, get educated, use PPE consistently, and report suspected cases immediately. If you're in endemic areas, participate in vaccination drives, report sudden animal deaths, don't consume uninspected meat, and educate your community. If you need help, contact IIVER. The details are given in the screen. We provide livestock vaccination, emergency consultation, diagnostic testing, and outbreak support. Together, we can make India anthrax free. So, if this video helped, make sure to like, share, and subscribe. And for more information, go to our website www.iverindia.com. See you in the next video. Bye bye.